There's one neck stretch that could actually be triggering your migraine attacks or other headache disorders, and most people don't even know they're doing it. So if you've ever been doing a deep chin tuck or trying to release the muscles of the base of your neck for your headache pain, you really need to listen to this. So let's talk about what these muscles are. They're called the suboccipitals, and these are tiny muscles tucked right at the base of your skull. So they're often blamed for a lot of neck tightness, involved with headaches like cervicogenic headache, tension type headache, and migraine. So I'm sure you've been told that you need to stretch them, especially if you've gone to physical therapy. And it also probably feels intuitive to stretch muscles that feel tight, right? Tight muscles, stretch it. But not really. These muscles aren't like your hamstrings or your chest muscles or your quads. They serve a completely different function compared to these primary movers. And they're built differently too. The suboccipitals have one of the highest concentrations of muscle spindles in the entire body. Muscle spindles are these small sensory receptors. And they're kind of thinking about like small little motion sensors that detect changes in muscle length and movement. So that's because these muscles are helping your brain figure out where your head and neck are in space so it can coordinate balance and eye movements. So they're constantly adjusting to tiny postural changes, make sure you're upright, balanced, and visually oriented to where you need to be. So especially with like head movements and eye movements and stabilizing our vision. But here's what most people don't even realize, that the suboccipital muscles don't have many or if any of another organ called the Golgi tendon organs, which are tension receptors that most muscles or tendons have, and they use to relax these muscles when they're being overloaded. This means that when you stretch them, especially when you're in like a deep chin tuck like this, they don't actually release like we want them to. So instead, our suboccipitals react with a protective response. They tighten up more, they guard more, and they're fighting back because they don't want to be stretched. Because they're wired to protect your head and your neck and your brainstem, not to be lengthened under load or stretch. Now, if you're living with migraine, tension headache, or vestibular migraine, this next part might be critical for you. The suboccipitals are closely connected to something called the trigeminal cervical nucleus, a key relay center for head and facial pain and neck pain. So when you aggressively stretch this region, you're not just irritating these muscles, you're also sending more neural and sensory inputs into this system that's already hyperreactive during a migraine attack or can be reactive in between attacks. So further inputs can, one, prolong active headache attacks. So if you're having a migraine attack, it can make it last longer. It can worsen your current headache attack that you're having, and it can even trigger a headache attack if you don't currently have one. So what you thought was a relief strategy in a suboccipital stretch might actually be fueling and putting more fire into a problem that you already have. There's also more. The suboccipitals also connect into our dura. That's the protective covering around the brain and the spinal cord via something called the myodural bridge. There's this muscular connection between the two structures. So stretching these muscles may actually tug on the dura, which is incredibly sensitive. That's one more reason this kind of stretch could result in more pain or other symptoms if you have migraine. There's even a case report of somebody stretching aggressively and causing a CFS leak following aggressive upper neck stretching. And then there's another consideration for patients that have hypermobility, which is common for those with migraine, or another population we need to consider because of the high comorbidity with migraine is those with Chiari malformation, where the brain tissue is kind of being pushed down into the spinal canal, and this chin tuck position actually increases that pressure that people are experiencing and can aggravate symptoms for them. So here's the bottom line. The suboccipitals aren't designed to be stretched. These are proprioceptive muscles that are built for precision and protection, right? So stretching them can actually worsen your headache symptoms by increasing sensitivity in the trigeminal cervical nucleus. And for many people with migraine, especially with hypermobility disorder or Chiari malformation, this type of stretching might be completely unsafe and should be avoided altogether. So if you've been stretching this area and hoping for relief, it's time to really rethink the strategy you're targeting to get that muscle relief that you're getting or looking for. And there are better ways to calm these muscles to support your nervous system and reduce head pain without triggering more symptoms. So come back tomorrow to my page. I'm going to show you different ways that I treat and help patients and exactly what I do to help get relaxation to the